Good afternoon, everybody. You're all very welcome to our 13th digital dispatches. Delighted to see some regulars and some new people in the audience today. I might ask some of you to turn your mute on just while we're having our conversation today. Delighted to have Angela Reid, Chief Nursing and Midwifery Information Officer from South Eastern Trust, Dr. David Grier, he's a consultant paediatrician and neonatologist from the Southern Trust, and Pippa McCabe, Chief AHP Information Officer from SCT. And they're here today just to give us a few insights from their perspectives. We will offer an opportunity for you guys to ask questions. We'd ask you to put those into the chat and we'll address those as we go along. Just to remind you, this is recorded and will be available for anybody who wants to view it again in the near future. Okay, so Angela, we'll start with you. Clinical leadership roles are really important in the wider Encompass team. Can you tell us why you applied for the role?
Sure, Linda. So I suppose digital has been a passion of mine and an interest really for many years. Now, I'm not going to tell you how many years ago, but I was one of the first women or girls at the time in Northern Ireland to study computer studies at AO level. So the very first time that that programme was run in Northern Ireland, again, I'm not going to tell you how many years ago, I undertook that A level. So it's been a lifelong interest, I would say. Interestingly, somehow or other, I have managed to produce a son who's a software engineer as well. So obviously, the interest that I have has migrated to the rest of my family too. So something that I'm really proud of. Unfortunately, he's not a nurse software engineer, but that would be the icing on the cake. So information on how we collect it and how we use it, I believe, can bring us so many opportunities to the health and social care table. And so I suppose knowing that Encompass was coming, I chose to focus a Florence Nightingale Leadership Scholarship that I got, which was across the UK in 2017 on digital practice. And I travelled to the US and Australia and indeed visited the Cambridge site, which had just gone live, was the only UK site using Epic at that time in 2017. And the thing that really impressed me about that team in Cambridge was how it was clinically led. Now, it took them, they'd gone on a journey and it had taken them a while to understand that the whole journey needed to be clinically led, but that's where they were. And I could see very clearly the art of the possible. And at that time, the people that I spoke to utterly convinced me that any transformational programme needed to be clinically led. And I was really struck that that needed to be both a team of technically enabled and then also clinically enabled leadership. So over the recent years, I would say I've also noticed that other industries have transformed how they've done things, and they have really been handing the responsibility and ownership back to citizens. So if you think about travel and banking and other industries have transformed how we do things, health and social care hasn't really been impacted in the same way. Now, I know they're not direct read across, and I know that there are many challenges in that space, but there hasn't been the same disruption. And I really do believe that as yet there are unexploited opportunities in this space. One of those examples I can think about is the public health benefits, and where Encompass particularly could support wider issues such as tackling health inequalities through better quality information and data, and opportunities to engage with people directly in their own health independence as they and prevent them reaching a critical stage or an acute admission. So the possibilities are endless, I really believe. So knowing that the possible was possible in Northern Ireland, and in the early days we talked about the art of the possible in Encompass, and the fact that Northern Ireland, so having travelled the world and looked at what other people were doing on the back of that scholarship, that opportunity that I had back in 2017-18, and knowing that Northern Ireland were in an entirely unique situation, I really wanted to step up and take on that leadership role. Now, it took us a while to lobby for the clinical leadership roles, and I would add to that, I think my particular skill set possibly work well in that space. This is a passion, and it's been also a portfolio that I've had a responsibility for in the region in the past. And also I'm a passionate nurse. The one thing I think, if you cut me open, you'd get NURSE in the middle. And so I really felt passionate about bringing digital along with the profession and making sure that as professions, nurses and midwives, and we know globally they are the largest users of technology by professionally regulated group, that there was strong leadership there at the forefront. So it was a no-brainer for me, really. This was something marvelous going to happen, and I want to be at the forefront helping all of the profession, all of my colleagues in the professions to get on board and to really make the most of this opportunity.
Okay, thanks, Angela. I might come back to you with a few follow-ups on that.
Sure.
David, turning to you in the world of paediatrics, what advantages of a single patient record do you see for the paediatric patients that you deal with?
Well, I look after children in a number of contexts, including the neonatal unit where I'm here today in Craigavon, but I also work in acute paediatric clinics, children's ward, and I previously worked in community paediatrics. And of course, many of my children are also seen by allied health professionals, community paediatric nurses, and often by specialists in other trusts, including Belfast. It means that currently my patients have multiple charts held in different locations all with different pieces of information in them. Having one single record available to all the clinicians looking after a child means that the information is more readily available and each encounter adds to the single record. For example, if an emergency care plan is created by a paediatric doctor in Belfast, it'll be immediately available to our emergency department and the paediatric team in the Southern Trust if that patient was to suddenly arrive up that evening. Something as simple as having a single growth record completed by different professionals would enable growth problems to be identified and assessed more effectively. At the moment, I've seen children with maybe 7 or 8 different growth charts held maybe in different places by health visitors, acute paediatric wards and community paediatric wards, and all that information isn't available to individuals. It also means that when a patient is seen by a new service, that parents don't have to start from the beginning describing what the previous problems were with the child and what problems have been addressed and what the current long-standing problems are. So it'll be certainly a lot easier for families to be able to provide information and recognise that clinicians will be able to have that information at hand.
What about the benefits that carers of the children might get from Encompass?
Well, I think the use of the patient portal is going to be very beneficial, and it will enable parents and carers of children to coordinate and keep track of appointments. This will be particularly useful for the parents of children with complex medical and developmental problems who are often seeing multiple professionals across different sites. It'll enable better communication and more effective communication with the parents, enabling them to get test results and appropriate clinical advice about their child's condition from a validated library of resources.
So do you actually think this will make care a bit safer for children?
Absolutely. We know from incident reporting that some of the most common adverse incidents affecting children in hospital involve medication errors. Some of these have the potential to be very serious. Prescribing for children is more complicated than for adults, in particular because of their greater size range. A paediatrician might be looking after a baby weighing less than 1 kilogram in the neonatal unit, and at the same time looking after a teenager in the children's ward weighing more than 100 kilograms. I believe that electronic prescribing and medicines administration could prevent many of the medication errors that we see in children. I'm on the medicines use and optimization decision group in Encompass, and I can see how the EPIC system is designed to make it easier to do the right thing and more difficult to do things wrong during prescribing and medicines administration. A few years ago, I saw how the EPIC system was being used by paediatricians in Copenhagen. Their pediatric hematology ward had noticed a significant reduction in their medication incidence involving chemotherapy since the implementation of EPIC 18 months earlier. The hematologists and hematology nurses believed that it was due to changes in staff behaviours brought about by electronic prescribing and medicines administration. And that's the thing. This is not simply the implementation of an IT system, but an enabler for cultural change. And I see Encompass as a way of improving patient care by making it easier to be a clinician and easier and safer to be a patient.
Okay. And I'm just going to pick up with you, David. Have you had feedback from other clinical colleagues to say that they're bought in, they're worried about it, they're concerned about it, or are they eager for this to come in?
All of those. And some people have views that vary from the same individual could be very frightened and very excited. And at times I'm both as well. This is a big change. This is the biggest change in healthcare that I've ever seen. And this is going to be very disruptive. And that can be a positive thing, of course, as well. There's obviously disruption. Disruption can be positive, but it can be very frightening for people. Things will change every day when people come into work. The things that they'll be doing when Encompass is in place is going to be different than what they're doing currently. And that's going to be concerning for them. But I think what we can do is by ensuring that they have the right information now and getting as many people involved in the development and the personalization aspects of Encompass, that what we can do is when this system is being implemented in each of the trusts, what we'll have is not just simply buy-in. What we'll have is we'll have clinicians who are eager for this to happen and can see the advantages that this will hold for them.
Okay, thanks, David. Pippa, you've been sitting patiently in the background waiting for me to come and ask you a couple of questions. Provision of information to patients about their conditions, very important, particularly to support people with self-management and those with long-term conditions. How do you think Encompass can support that?
I think David's already mentioned about the patient portal, or we'll be calling that My Care Record. And I think that is the bit I am most excited about, is putting patients' health information into their own hands and giving them ownership of it. As allied health professionals particularly, I know it's across all of the professions, but those are the ones I know about more. We give a lot of information to our patients, and we tend to give them a paper leaflet or something like that they take home and stick in a drawer and maybe look at it a few times. And then particularly those with long-term conditions might not be able to find it when they really need it. So the patient portal or the My Care Record will have the ability to store all of that information in it, which means that patients can't lose it so easily, and they can go back to it as they need it. And David mentioned as well that trusted library of resources, which I think is going to be really important, trying to take patients maybe away a little bit from Dr. Google and having all of those places, all of that information in one place that's easy to get to and they know is trusted and that we know is trusted as well. The portal will have all of the information around your appointments, your medications, your allergies, all of that information again in one place. And as David mentioned, it'll be shareable. So David mentioned parents having access to children's information, but particularly in my life over recent times, it would have been really helpful to have had that for my parents. There's a lot of coordinating of appointments going on, particularly when there's palliative care issues, and the ability to be able to have your information about what your wishes are and share that with family members as well as your clinicians. So I think all of that will really help give ownership to patients. During the pandemic, our AHPs were particularly keen about getting information to the right people at the right time. And there were some concerns about sending information electronically. Maybe it wouldn't get to the patient, maybe they wouldn't look at it. And the governance around potentially them sending it on to somebody that it wasn't going to be appropriate for. Well, in a patient portal, all of that is looked after. They have the secure login. They know that that's their information. So I think it's going to be really exciting to see what we can develop knowing that and having the information flowing between patients and clinicians.
So you've sort of touched on my next question. What about the other way around? What about patients that want to share information about their health with their care providers securely? We know that happens in some specialties already, but how's Encompass going to help?
So we've got some really lovely examples of that in the AHP world, particularly in like pediatry, and patients being able to share photos of foot wounds and how they're progressing, or in diabetes or dietetics, diabetes reversal programs where patients are uploading their blood sugars and their blood pressures, and the clinicians are able to monitor that. All of that will have a lot more security and governance around it once it's within a patient portal, because that information can then directly transfer into a patient record and be held in the notes as well. And the other things that I've really struggled with during my clinical career are the likes of pre-assessment questionnaires and post-treatment outcome measures. Those kind of questionnaires are things that can be populated in the patient portal so that the patient can fill them in before they even come for the appointment to save a bit of time, get that workflow running better, and also then after they've seen us, for us to help gather the information to know that we've been effective, and then we'll have real data and evidence around that as well.
And are you getting feedback from your patient groups that this is something that they're looking for, or are they anxious about it?
I think for the ones that have started to use it, it's going to be a big cultural change. So there will be people that will be, what's the word? Not anxious necessarily, just it's something new, so they've got to get used to it. And there'll be people that won't use it, Linda, you know, and that's fine. We're not saying everybody has to do this. We will have other options for people that don't wish to. But I think personally, me as a patient, particularly over the last couple of years, I would love to have had access to my appointments in a portal and the results of something that I've been waiting on for a very long time, viewable in a portal. So personally, I think if I'm an example of a 42-year-old female, it will be something that's useful for all of our patients. Yeah.
Okay, thanks, Pippa. Angela, just coming back to you, looking at what encompass means to staff, I've touched on it with both Pippa and David. I know as part of your role, you've been speaking to staff about encompass. What's your sense of how staff feel about this whole digital transformation programme?
So, Linda, good question. And since, just to say, I've come to the South Eastern Trust in the last 6 months. I began on the 1st of January 2022, so new year, new me, new opportunities. And I've had lots of opportunities. The Trust have been fantastic as part of the wider family in the Trust to speak about Encompass and digital practice in generally. And just to say that Encompass is currently just a part of my role, but Kevin Conway, our executive support to the Encompass programme, and who is sadly leaving us today, but will be replaced by able people going forward as from next week. But Kevin has said in the past that Encompass may not be the only show in town, but it is the flagship, and I would agree with him entirely. And through Encompass, we will achieve so much in terms of our digital practice in the future. So in the main, whenever I'm speaking to people, whatever it is, whether it's digital practice, whether it's Encompass specifically, whether it's other aspects of nursing and midwifery practice, Encompass is always part of that conversation. And mostly, I suppose I ended up being quite surprised by this, really, but I'm not sure why I ended up being surprised. I thought maybe people would be very anxious and maybe a little bit fearful, if I would use that word. But mostly I'm met with lots of really good questions and a level of excitement about this. And David and Pippa have both talked about it's a transformational change. And I would agree with David, this is going to be the biggest thing that has hit health for, well, as long as I can remember, other than the pandemic, I would say. The main things that people are talking to me about are the opportunity to reduce data entry duplication. So this is a biggie for them. Data entry once used multiple times for different purposes, and also reducing the number of times that we have to ask people questions. So our service users, our patients, clients, our mothers, our parents are only going to be hopefully asked a question once, and that information will then populate a range of data fields within the record. The opportunity to have good communication across teams, accessibility again of information, reduction of errors. David talked about this earlier on, and incidents through the ability to use best practice advisories and that advice and guidance in the background in terms of readily available whenever you're completing a record. That should all be built in. And in a way, in my mind, the record and the system as a whole really acting as an opportunity to enable continuous learning and also improvement at the same time, supporting good patient experience. And then finally, both David and Pippa have mentioned this element through the My Care chart. I think people are really recognising the opportunities that are going to present themselves through partnering with our people, the people of Northern Ireland, in a different way, accepting that not everyone will want to take that opportunity. I was at a national conference in May of this year, and I was speaking on a different subject matter, something that I've been working with the Republic of Ireland on for a number of years now, and it was a conference for nurses and midwives. But as part of that conference, there had been an invitation-only event in the afternoon, which was with the wider professions in the Republic of Ireland. And they were thinking about the opportunities, what the challenges and opportunities were for moving the system forward in the digital practice space. And it was really interesting. As they were all talking, I was mentally ticking off what was coming in Encompass and what we were going to have here in Northern Ireland that was what they desired and what they saw as the enabling factors for the future. And so for me, I think staff are grasping the fact that this is a unique, and it is a globally unique, and when we get Encompass over the line across the 5 trusts, this will be the largest implementation in Europe that EPIC have done. And so there is a unique opportunity for us here in Northern Ireland to really showcase all that's good. Now, I'm pitching a very positive view. Is that the only view I've heard? No, it's not. And there are a number of people who are maybe thinking, well, you know, how's the Wi-Fi going to work? Are we going to have enough devices? And yes, of course, those challenges are there. But on the whole, the overriding message is real positivity, and accepting that even though we have these challenges ahead, in that space, if we all collectively work together, we'll find the solutions and we'll have something really worth celebrating at the end of all of this.
Okay. Just a wee reminder, folks, if any of you have questions, just as I'm asking these questions, please put them up in the chat. Angela, one final thing. If you had one message for people to take away from this today, what would it be?
So Linda, I've got 2 halves to that one. So the first bit of so there's an overall message in all of this, and hopefully you'll hear this message. The first thing that I want to say is that we're moving at pace with this programme of work. We're finishing build wave 3, we'll be into a final build wave, and then there'll be testing, more testing into the summer and autumn. And we really have an opportunity here to work collectively together. The train has left the station and we are moving at pace. So that is the first thing that I would want people to hear. The second point that I would want to, which is part of the whole thing, is that Encompass is a regional solution. It is for everyone in Northern Ireland. It's regionally agreed, and then it's going to be implemented locally. And obviously for Pippa and I in the South Eastern Trust, that feels a little more sharper than everybody else, because we're the first people to go live, hopefully in the autumn of 2023 next year. So the system has to be fit for purpose for us all, for all of our professions, for all of the people working, for admin, for our corporate functions, for business intelligence, for the regulated professions, those who are not registered, everybody that's going to use this system, it has to be fit for purpose. And we want to make it the best solution that we can possibly offer. Obviously accepting that there's going to be a period of optimization. We'll not get it right fully right in the first instance. And so we need to continue to build collectively together. So with all of that comes a responsibility. So we're moving at pace, but we collectively as professions, as people working in health and social care, and possibly for some of us as patients too, because we will be looking for people to engage from a patient perspective, there comes a responsibility. Please don't stand back and say, well, that's Pippa's job, or that's Angela's job, or that's David's job, or that's Dan West's job. This is about the collective. It will be the single, you've heard this many times, the single biggest transformation that we've seen in health and social care for many, many, many years. And again, I'll reiterate, the biggest implementation that EPIC have done in Europe by the time they have us finished. Unique opportunities. So I'm going to shamelessly steal an analogy which I heard a couple of weeks ago by my good colleague Claire Buchler, and I thought it was a really good one from Digital Health and Care and I. she said in a meeting that I was at collectively, you can't whistle a symphony. And she's absolutely right. This is more than one person. It's more than just a few people. It's everybody, the collective, lifting together and finding those solutions. So when you get that opportunity to join in an Encompass decision group or in an Encompass focused content design group, or you're asked to put back your opinion through an email that you get, do it. Your voice needs to be heard, and we need everybody collectively lifting to get this over the line. So that's the big message. Please get engaged, get skin in the game, so that we can all collectively be proud of something that is unique globally.
Just saying, quote of the day, you can't whistle a symphony.
And it was stolen. It was stolen.
I'll pass that on to Claire when I speak to her later. We have got one question from Paul Crothers. Still not 100% sure about the scope of Encompass. Now, this is a recurring theme that comes up. Not everybody's as clued in, doesn't necessarily know where to get all the information. So is the intention for patients to access their details and add to their records online, maybe using an app? Or will there be support for those who don't have the technology or are not digitally literate? This one pulls right at my heartstrings.
I had just started to type a reply, so I will start and then I'll hand over to the other two to finish. Give them the half bit. So the answer is yes. The patient portal or My Care Record is available online and as an app on your phone. So for the people that choose to use that will be available. But you're absolutely right, Paul, that there will be some people that they won't want to do it or they won't have the skill set to do it, and we are working with our DHCNI colleagues and will do over time as to how we can help the public to be able to manage that more easily. I had something else in my mind there that I have just lost my train of thought to say. Oh, that's a shame. Never mind, I'll pass on to one of the other two to see if they can back me up on anything. Oh, it was about scope. Sorry, really quickly. Yes. The exact information of what is going to be functional in the app. There's a lot that it can do, but exactly what we are going to choose to go live with it working at is still being decided. And I expect that might change over time as well. So there's an awful lot of things that it can do, like messaging clinicians back and forth. And some of that may not be active when we first go live. It'll probably be something we develop over time.
And if I come in there, Pippa, so absolutely right. I suppose the messaging, this is a really big, significant cultural shift for all of us, not just in health and social care, but also for the public of Northern Ireland. And so there's lots of examples across the world of where a My Chart or My Care Record app has been used in different environments. Now, if we look at the like of the US, that's a different economy. It's a different way of doing things. And so there's not a direct read across there for us. But for the UK, where trusts have switched this application on at Go Live and then encourage sign up, and you do the My Chart or My Care Record application will require people to opt in. The conversation around whether or not the records are going to be online is a different one, and for the most part everyone will be online unless they opt out, and we're still having conversations around that at the minute. But the My Care Record application is something that people have to opt into and actually seek for themselves. Pippa has already said about the functionality of it. The one thing for me is that My Care Record, the functionality, it's not bottomless or endless, but it's huge. And so going back to my first point that it's a cultural shift, it's a change in how we do things. We don't want to switch everything on at the beginning because we would possibly become a little bit overwhelmed. And so we want to switch on the things that we think will be a little bit game changing and that we will really benefit from and we will learn from, and then incrementally, almost like a quality improvement or service development project, incrementally add as the public get used to doing it and as we as clinicians get used to responding within the My Care Record application.
Yes, I mean, this is going to empower people to look after themselves, and I mean, and people will get more and more used to being able to do that. At the moment, pregnant women carry their own patient-held records. And of course, we have our red books for babies and children. And all that's going to go onto this MyCare record. And it'll enable people to be able to access information that they previously wouldn't be able to access before, but also the clinicians to be able to monitor things that parents are putting on as well and patients are being put on. And something as simple as a pre-clinic questionnaire could actually smooth out the process of a patient coming to an outpatient appointment, for example, for an assessment for surgery or an assessment because of headache. A lot of the information that could be available to the clinician before the patient is seen at the clinic could be made available by the patient. So it would actually make things easier for the clinician and for the patient once this information is on that. So this is actually going to be empowerment for our clients and our patients. And in terms of our scope, this is the term encompass, I think, speaks to this all. I mean, there's a few things that are out of scope, but all hospital records are going to go on to the encompass system. Every inpatient record, observation, medical medicines, prescriptive prescribing and medicines administration, all outpatient records and our outpatient notes will all be going on this. So this is a huge, huge area, and not just within healthcare, social services and social care as well. This is, so as Angela and Pippa said, this is the biggest thing that's happened, and it's the biggest thing for EPIC as well, because it's not just involving hospital care, it's care within the community, and it's social care as well. So this is a huge thing for Northern Ireland and for EPIC.
We've just had a comment from Brenda who's saying it would be good to share some of those examples about, you know, the maternity patients and how their records are going to change in the future. I can recall maybe losing a file or two myself back in the day. So, you know, that really brings it to life, you know.
Absolutely, absolutely. And I mean, it is very empowering for people to carry their own records around. And I'm currently in a neonatal unit at the moment, and I'm right beside maternity outpatients. And I see women coming in and out with their green folders all the time. But that's record, they can keep that record, but that record isn't actually available to anybody else. So if a clinician wants to follow up on something, that's not going to be available to them until the patient comes back again. By having a single record that the patient can add to, and the clinician can see and add to as well, is going to be incredibly important for ensuring continuity of care.
And just to go back to the original question about people who are maybe not digitally literate, DHCNI, as part of their wider digital strategy, do have a plan to work with the likes of the local libraries, you know, for people who want a bit of help, who maybe don't even know how to create an email address, don't know how to log in, don't know how to do two-factor authentication. You know, we'll work with our partners in the wider community settings as well, because, you know, our practitioners don't always have time to sit and explain that in a clinical setting, and patients might be a wee bit nervous about even asking those questions. So we'll be using other community forums to try and improve digital skills where people are keen to learn.
If I, Linda, could just circle back to and I'm not sure, I'm sure there are many, many, many Brendas in Belfast Trust, but given the content that Brenda has focused on, I'm wondering if it's my colleague Brenda Kelly, possibly one of the midwives in Belfast Trust. Just circling back to the midwifery and the question of mothers and the maternity record, handheld record in Northern Ireland, RD&E, whenever they went live, they switched the MyChart application on, or what we're going to call MyCare record. And actually the group of people that there has been the most success with are expectant mothers, because they're very focused on their care. And as David says, it's in everybody's interest to share that record and for them to understand what that looks like. So they had huge success with that specific patient grouping through the MyChart application.
One other question's come through. David, you mentioned community. And this is another question that is recurring in lots of forums that I've sat in about the involvement of GPs. So a lot of care takes place within the GP settings. So does this include a record for GPs?
The GPs will have access to the encompass system, and they'll be able to access all the information on the encompass system. As you know, each of the GPs have electronic systems, and they're far ahead, and far further ahead than the trusts have been in terms of adopting IT systems, and their IT systems on the whole are very, very good. So it is not planned at the moment that the GPs will adopt the encompass system, but they will have access to it. And there is, in fact, the EPIC team are working with GPs and with other providers who won't be within the encompass scope to enable people who should be having access to information, to enable them to have safe and effective access to information. And that in particular includes GPs and community pharmacists.
Thanks for that. Okay. Any more questions? Any more before I thank our panel for coming and spending their lunch hour with us and giving us some insights? Okay. Thank you for everybody who participated today. We have 113 people live with us over lunchtime on a Friday afternoon, which I think is great. The recording will be available. And just a heads up that next month we will be meeting on the 1st of July, and we'll have Carolyn McLaughlin here talking about cyber, something that's always at the forefront of our minds at the minute, given recent news headlines. So I hopefully will see some of you back again on the 1st of July. Thanks again to Angela, Pippa and David for taking the time to answer our questions today.
Thanks everyone for the opportunity, and happy Friday.
Thank you. Have a good weekend.
Bye.
Thanks.